Hi, and welcome to CryptoBiography. I'm your host, Brandon Starr, and this is episode 139. It's going to be part 2 of The Patient. And if you have any comments or questions about this episode or previous episodes, cryptobiography@gmail.com or hit us up on Facebook or Twitter. And here we go. Let me see your skin then. Dr. Williams pulled on fresh examination gloves. She then took another look at the still slightly mobile snakes and asked, "Will they bite me?" "No, I don't think they have the power any longer." "Okay." Dr. Williams looked at her, at Medusa, as her mind refused to use her proffered name. She appeared to be 30 years old, although something about her manner and her gaze hinted at her true age. The snakes, where they met her skull, did not immediately transition to regular skin, but slowly changed from scales to skin over a few inches. Thus, the upper part of her forehead appeared to be scaly. Her skin had a slightly greenish tinge. "Is this your normal skin coloring?" she asked. Medusa laughed once. "I'm no longer certain what that word means when applied to me," she said, "but as my snakes die, the rest of my skin has started to revert to my old olive-complexioned human tone." Dr. Williams nodded. "Please stand and disrobe." Medusa did so, and Dr. Williams examined her up and down. She seemed to be simply a fit, adult female with nothing unusual about her, save the skin tone. "Do your snakes hurt?" she asked. "Yes," Medusa said. "They are apart from me, had a bit of their own mind, but were a part of me as well. I feel them dying." Dr. Williams nodded and put her stethoscope in her ears. She listened to her heartbeat and her breathing. All seemed normal. "May I use a stethoscope on one of your snakes?" she asked. Medusa nodded. She did so and heard a faint, somewhat irregular heartbeat. She did not know if it was fast or slow for a snake, but took the speed, thinking to check it later. Not that these snakes were necessarily typical in that or any way. "When did you notice something wrong with your snakes?" "A bit less than a year ago. I don't know, perhaps they were being affected even before that, but if so, I didn't notice." "I take it this was a long, slow process then, or did it suddenly accelerate, causing you to visit me?" "Both. Or perhaps it seemed slow, then suddenly became noticeable." Dr. Williams continued her examination. Remarkably, there was little to tell from her examination. Other than those aspects of Medusa she had already noticed, everything was normal. Pulse and blood pressure, temperature, reflexes. It all checked out right near normal levels. She took a blood sample. It should have been done by a tech, but that was not going to happen, and ordered a wide array of tests. She also took an x-ray of Medusa's head. Her clinic was well established, and she was thankful that no special accommodation would have to be made. She brought Medusa in front of the screen, and they looked at it together. Medusa seemed fascinated by the technology. "Have you ever been x-rayed before?" "No, I've read about the technology and seen some pictures, but no." They looked at her skull and the fine tissues connecting it, barely visible, then above a mass of small bones. "We got lucky. The snake's bones don't connect to yours. They are held on through ligaments. That will make the surgery much simpler. I won't have to shave down bones. It also likely will make it easier to determine where the snake tissue ends and your own begins." "And what will you do?" "Well, we will start by removing the snakes one by one. Then I will have to dig down and scrape out all the snake tissue until we can be sure it is all you remaining." She was pleased to note that Medusa did not cringe at the rather blunt language she was using. She did not let it show on her face. "The real question is skin grafting. There is very little spacing between your snakes, and perhaps none once I go in there, and that means this is going to end up as a large wound to cover. I'll have to get a large, expensive graft." "Cost is not a concern." "Very well. Now that you know the extent of the work that you'll need to be done, can you perform your art here?" Dr. Williams considered this. "Normally I would prefer such an extensive operation to be performed at the hospital, but I understand that this is not really feasible for you. The main reason for having it at the hospital is in case something goes wrong. I have all the equipment needed for this here. The skin graft is concerning due to its size, but I've done many skin grafts before. She thought a moment more. Though I pride myself on my work, I am not a plastic surgeon. I can minimize scarring, but there are specialists who can do it better. You could go back and have any scarring minimized later, but it would work better if done at the time of the amputations. Of course, this means bringing in at least one more person. Medusa shook her head. No, definitely not. I am taking enough risks already. Then I think we have a plan, Dr. Williams said. The surgery took place 2 weeks later. Dr. Williams and her assistant and anesthesiologist even practiced, walking through it step by step. That night, Medusa returned in the Mercedes-Benz with her assistant with the unplaceable accent. He again sat in the darkened waiting room. I'm ready, she said when asked. She disrobed and was given a hospital gown and slippers. The assistant and the anesthesiologist both gasped when they saw her. Dr. Williams was annoyed. Medusa's condition had been told to them. Had they not believed her, after all? Did they think they were being 10 times their usual rate for some joke? Medusa ignored their reaction, however. She laid down on the table. Her snakes drooped down. Dr. Williams noted that they seemed to move even less than during the consultation. One even seemed to be dead. It had no visible movement, and its eyes were clouded over. No sense trying to determine if it's alive or not, she thought. They all have to go now. And the work began. Dr. Williams was not just a good surgeon. She also was a good planner. She knew exactly what tools she wanted to use, what steps she would take, and what she would do at every point if something went wrong. Because of this, the work went quickly. The work was being done on a Friday night because the possibility was there that they would be there until next morning. But by 2 a.m, she was finishing up. There was a large bag of medical waste. The work had also been helped by the surprising fact that the snakes did not seem to have connected blood vessels with Medusa. They instead got nutrients through the blood by what was essentially a placenta. This placenta on Medusa's side covered the entire region. That all had to be cut away. It had several fairly large arteries feeding it, which needed closing off. Fortunately, Dr. Williams had anticipated all of this. Not being a real believer in magic, even with Medusa right in front of her, she suspected that the snakes were somehow getting fed by Medusa herself. And even that was not a problem. The skin graft went smoothly as well, and though it wouldn't be perfect, it was as good as she could make it. Not a hair follicle remained, even around the site, let alone between the serpents, which had all been excised anyway. The anesthesiologist slowly brought her back up. Only 1 unit of blood had been needed during the surgery. Dr. Williams suspected she would recover quickly. By 3 a.m, Dr. Williams asked Medusa, "How are you feeling?" "Well, actually," she said and smiled. "Better than in a long time. The anesthesia doesn't seem to be bothering me." "That's good," Dr. Williams said. "You'll need to rest, and we will give you some pain medication. I'm hoping that the scarring can be minimal. I see that a lot of your green coloration is fading." "Quite possible. Almost all the effects of my old curse seem to be lifting. The curse also gave me immortality, so perhaps my quick recovery is just one last little effect from it before it goes away forever. I could be wrong, but I think the last of the Greek gods have died. I believe I am mortal again. It is a strange feeling." And she began to cry right there on the table. "I can only imagine that change," Dr. Williams said. "Yes," Medusa said. "I gave up on being mortal again centuries ago. I thought it was permanent. But apparently when Athena's power faded, the curse did as well." "Why do so many stories say that Perseus killed you?" Dr. Williams asked. "There were a couple of Gorgons, real ones, born ones," Medusa said. "He killed one of them. My story got mixed up with theirs. But I was a human woman before Athena cursed me, though I was similar enough to them after. I suppose congratulations are in order then. You lost your immortality, and you will now die, but as a human woman again. Medusa wiped away her tears and nodded. Yes, finally, their power is gone. And thanks to you, I won't die a monster. You have my undying gratitude, if that is not too ironic a phrase. Dr. Williams smiled. Rest now, Ms. Fidelia. And that's the end of the story. I hope you enjoyed it. If you have any comments or questions, as I say, cryptobiography@gmail.com or hit us up on Facebook or Twitter. And thank you for listening. Words and music, copyright 2020, CryptoBiography LLC, all rights reserved. Characters and events are fictional, fictionalized, or satirical.